It feels like nothing else is happening in the world besides COVID. But the truth is, the same number of people who are longing for a baby yesterday are longing for a baby today. I am with a very special guest today, Dr. Diana Chavkin, and she is both an IVF mama and an IVF specialist. We are here to kick off our Hopeful Stories series to help people get through not just this dark time, but also the dark time of infertility. Diana, thank you for being with us. You're coming to us from HRC Fertility in Los Angeles. We're so happy for you to join. When you became an IVF doctor, you certainly weren't expecting that you were going to need the services of your field.
No, I certainly was not. And let me just say thank you, Alice, for that introduction. It is an absolute pleasure to be here with you. I appreciate the invitation. We spoke about us having this conversation weeks and weeks ago before COVID was on any of our radars. And I do appreciate the fact that we are here today still talking about it, despite the fact that really everything on everybody's mind has to do with COVID. And I just want to take just a second just to recognize that this is a very stressful time really for everybody because of COVID. But in my practice, as in a lot of practices all over the country, you know, the same patients who wanted to get pregnant before still want to get pregnant now. A lot of them, because of COVID, are on pause. I will say that I am still seeing patients by phone and by Skype remotely. I'm doing new consultations and follow-ups as much as possible. My current patients who are in cycle when this all blew up are still we're completing their cycles, but in terms of starting new cycles at the moment, we are just on pause. But again, I'm still engaging with my patients to try to, keep things flowing so that when we're ready to fully open our doors again, we'll hit the ground running. But it's so important. And I just also, I'm still very, very happy to be here to talk about something else other than COVID, again, because fertility is still on people's minds. And as you say, when these sorts of things happen in our world, the feeling of wanting to have a child almost gets heightened, right?
Yeah, I think your instinct is, I need to live the life that I imagined right now. I need it right now. And I went through that when I was diagnosed with cancer in 2008, and I was diagnosed 6 months before that recession. So I was going through kind of a double whammy of a time, right? Loss of job, loss of career, loss of house, loss of income, loss of all these things. And yet the thing that I clung to were my frozen embryos. I mean, I truly did. I had the image of getting to be a mom, and it gives me goosebumps now that I have a 6-year-old that was frozen in 2008. Conceived in 2008, born in 2013. And we know that there are people this year who are going through the same thing, freezing embryos so that they can then do a frozen embryo transfer later. But it gave me such hope.
Right. That's exactly right. And, it's hard, though, because there are a lot of patients who wanted to start for that reason. But because of what's going on with coronavirus, at least at this point in time, most fertility doctors and, according to ASRM guidelines, are really recommending that we don't initiate cycles. Although, as you say, it's unfortunate because going through the cycles and freezing embryos could provide people with that hope to get through this hump of what coronavirus is putting forth for us. But just weighing everything, it is, I think, just at this point, and it may not be for too long, but just at this point to kind of take pause and say, okay, at this point, we're not going to initiate cycles, but really, whether we have to wait a few weeks or a month or two, that's not going to have huge impact on people's fertility. And, although the people who were lucky enough to freeze their embryos and do their cycles and finish up their cycles, yes, in that sense, they're lucky in that they have that, in the freezer, in the bank for later. But the people who are about to start cycles and were not able to, they're still on the radar, right? They're still going to move forward. We're still going to get them through. It's just going to be a little bit later, but we kind of still have to hold on to that goal because that will happen.
Now, when you wanted to become an IVF doctor, I love hearing that part of your story because you have such a wonder, kind of about the human body. So I would love to hear what happened in school to trigger this down.
It's so interesting. So even before I went to medical school, one of the things that drew me to medicine, I mean, first of all, it's just like the body is just miraculous and amazing. But the thing that really was just like so fascinating to me was the menstrual cycle. I mean, it is just the most miraculous thing you can imagine. Every month, a group of follicles come up. They're stimulated by this beautiful orchestra that happens in your body between your brain and your ovaries and the blood in your body and hormones being sent and communication being sent through your body, right? And all of this happens every month so that, women can one day have a child. And it was really that, just the menstrual cycle in general that almost drew me to medicine to begin with, right? And that kind of stuck.
Orchestra. We should describe that to all junior high girls, that it's an orchestra. I love that so much. I haven't heard that before.
Right. No, I mean, it is, right? It's like this beautiful interplay of all these things. And that was really kind of what drew me almost to medicine to begin with. And that kind of stuck with me throughout medicine. And that was eventually what drew me to OBGYN in general, and then to my fellowship in reproductive endocrinology. Because although there is this beautiful orchestra and there's all these things that happen, right? A lot of times it does not happen the way we want it to. And there are things that glitches in the system, but being able to understand kind of the basis and the what happens normally, right? We can sort of understand what happens when that does not play out in its full function, and how can we manipulate so that people can still realize their goals of parenthood.
When did you know, though, that you were going to end up having accurate empathy for your patients? At what point in your time of family planning did you say, I'm going to need to utilize IVF here?
So I definitely did not go into OBGYN. I definitely did not go into fertility training because I thought that I was going to need my own expertise one day. It was really towards the end of my residency, beginning of fellowship, middle of fellowship, where I started to think, okay, like I'm in the middle of this very rigorous training. I'm not going to be prepared to have a child anytime soon. And so I knew that it was going to be towards, the end of my 30s where I was going to be able to even think about starting to have a child. And I know that as women get older, right, and we all know this, but especially it was in my face all the time, right? I was treating patients having this issue. As we get older, we lose our eggs. That's just a fact for all women. Our fertility declines as we age. The eggs that we do have undergo chromosomal changes that make it harder for us to have children. And so I knew that was going to be an issue for me, in the future. I'll tell you, at the time in my fellowship, I thought about freezing my eggs, but when it was an option for me when it would have been potentially appropriate to freeze my eggs in my mid 30s, at my time, it was really still considered experimental. So before 2013, ASRM said, if you're going to freeze eggs for fertility preservation, it should be considered experimental, mostly because there was not enough data to show us that a frozen egg and a fresh egg results in similar chances of pregnancy. In fact, frozen eggs were thought to result in much lower chances of pregnancy. And because of a few things, so the data was not collected at that point yet. And also, the technology was not as good. So back in the day, we used to freeze eggs by the slow freeze method rather than vitrification, which is what we use now. And we know that slow freeze is just not as successful as vitrification in terms of pregnancy resulting. And so when we did it, when I was in fellowship, we did a ton of it. And this is how I know you back in the day from the Oncofertility, right? And so we did, cases of egg freezing for women who wanted to preserve their eggs, who were going to undergo chemotherapy, right? And treatments that would potentially impact their fertility. And so we would do, they would have to sign an IRB and it would be part of a study, but it was not really considered standard of care. And so I made this decision at the time. And, I'll tell you, I look back at this decision later on in my life as the wrong decision. I wish I had frozen my eggs. At the time, I decided not to freeze my eggs because I thought, well, it's probably not as successful as regular fresh IVF. And so when I'm ready to have a child in a few years, if I need fertility treatment, I'll just do IVF, right? I think that if I froze my eggs at the time, my course would have maybe been a little smoother and a little less stressful. And I will tell you that when I eventually did try to have a child and I was not able to, I was kicking myself for not freezing my eggs back then, even though it still would have been under an experimental protocol.
I think there's a lot of women who go through that. you know, there's a lot of women, especially now that vitrification is standard of care for fertility preservation. I think there's a lot of women that they wait so long and then they choose the route that I went down as, you know, single mom by choice. And they're going, I wish I had just gone ahead and done that 10 years prior. I wish I had frozen my eggs when I had the chance. And just more choices, right? Because it boils down to just having more options and not feeling like you only have one option.
Absolutely. Absolutely. I mean, and yes, and I see, you know, people a lot who think, you know, well, one day I'll do IVF. And it's interesting because I had the similar thought, so I can't really follow you.
Right.
Oh, you know, one day if I have trouble, I'll do IVF. The problem is that IVF is less successful as a woman ages, right? As time goes on, IVF is not the end all be all that's going to just save the day. And so freezing one's eggs, and especially now, you know, just because we do know that it is as successful as performing IVF in fresh eggs, and it is not considered experimental. It is considered standard of care. By freezing eggs, it really does potentially improve someone's chances of having a child down the road. So because of that, I'm a huge advocate for egg.
Yeah. As am I, in particular, because what it also opened up to us is, you know, back when I did it, it was the same as you. You know, I was 31, 2008, you know, slow freezing, and they said you have a 3% chance of this working, and I thought, well, that's not good odds. I mean, I know 100% that I want to be a mom. I can't take a 2 or 3%, you know, risk on that, and so I pick an anonymous sperm donor at the time, which is a whole nother Facebook Live about how to even do that from a catalog at the time, a printed catalog. But I did split my cycle, and so I still have unfertilized eggs that were slow frozen, but I did end up using my frozen embryos to do my transfer. And but the rationale was the exact same as you. It's like, well, gosh, I mean, if that was the only choice I had, egg freezing, I might have rolled the dice too and said, we'll just do IVF later. There's got to be some good eggs left from chemo. And I feel very relieved that I went ahead and went down that path. Of course, you know, I have a 6-year-old that I'm completely madly in love with. So, you know, that had been a frozen. Yeah. Surprised he hasn't interrupted us yet. But, so, you know, you didn't have a smooth path. You know, when you told your story to me, your story is miraculous.
Yeah.
I mean, that.
So I finished fellowship and started practice in New York. And soon after, my husband and I were trying to conceive. And can I be honest with you? I didn't, you know, have like a full consult. I kind of me and my colleague next door, we decided, okay, let's just give you some Clomid and see what happens. And I'll tell you, a lot of OBGYN residents who don't have time to go to the doctor and take care of themselves, they're just basically giving themselves Clomid, and a lot of success stories. I was like, listen, my friends did it, it worked for them. I know Clomid works, and so, you know, let me just take it. And so I took a few cycles of just Clomid. I didn't love it. I'll tell you, I had a lot of side effects from it. And it didn't work either. And so after a few months, I decided I wanted to do something, you know, more efficient and effective. And again, knocked on my colleague's door next door to me, and I said, okay, let's start IVF. And I was on my cycle, and she's like, well, let's start right now. And I said, okay. I was a little taken off guard, but I was like, all right, let's do this. Did an ultrasound, got my meds, started, and I actually went very, very quickly. And yeah, before I knew it, I was having my eggs retrieved. And, you know, it's so interesting because although I've done it hundreds of times for other patients, as a patient myself who, like, you know, totally, I'm healthy, I work out, I eat organic, I do yoga, I'm like, you know, even though I know that still with age, there is an issue. When it came down to it, as myself, as a patient, there was almost this surreal experience of like sitting there with all the vials and the needles and the alcohol swabs and sitting at the table. There's almost just something like, I don't know, depressing, like giving up this, like, I wanted to live a natural life. Like, I wanted to be a mom, and like, what's more natural than that? And here I am sitting with all these vials and powders and injections. And it freaked me out the first few times, I will say.
Wow.
Just from a personal standpoint, it's just very
with. Absolutely. I mean, I mean, that's called accurate empathy, right? I mean, you've lived through every one of those very roller coaster emotional moments that your patients are, never once probably anticipating that you would be the patient.
Right. Exactly. Helping people through it is one thing, and then going through it yourself, you're like, oh my goodness, this is just such a, surreal experience. And anyway, so I also will say that even though I'm not scared of blood, and I am a surgeon, and I actually love surgery, and that's one of the reasons I actually went into gynecology, I had a very hard time getting the injections myself. And that's actually, it's interesting. A lot of my patients don't have any issues with injections, but the patients that do, I can really empathize with, which is very interesting, just because I feel like, I don't know, as physicians, we don't have trouble really giving someone else an injection, but
you're in control. You're in control of that situation. Now you're the recipient, and I completely understand that too. It was a little different for me with cancer because so much was already happening to me that I actually found it really empowering to do the injections myself. Yeah, I felt like, well, I can control this. I liked pinching my belly. I didn't mind any of the black and
I could see that
on my tush, because it was the only thing
I could see that.
could do at the time.
Right, you were in control of that. You were taking that control back. I think for me, I felt a little bit of like a lack of control.
Yeah, of course. And you had just spent all these years being in the driver's seat, being the one to calm people down, being the authoritative, and I can imagine how vulnerable you felt for the first time.
The first injection, my husband gave it to me. I laid down on the couch for a half hour. And I'll tell you, and I tell all my patients this, although most people don't really agree with me, I didn't like the injection in my belly. I really, I had to lay down on the couch literally for a half hour afterwards. But then I did the injections in my thighs, and so much better. And so I tell people that's an option, although most people don't really love it in their thighs. Some people do. In some way, I feel like it's further away from me or something, it's like further away from the sensitive part of me. But I got through that I got over that very quickly, in the way that most of my patients get over the whole needle thing. And by the end, I was also injecting myself and had no issue with it. But at the beginning, it was a little bit scary and freaky.
What was the result of that first cycle?
So, as I said, I kind of rushed into it. Just kind of was like, yep, let's start. As doctors, we sometimes don't take care of ourselves in the way we take care of our patients. And so in the middle of my cycle, as I was already almost ready to get my retrieval done. And I will tell you, this is back in the day when we thought, when fresh transfers resulted in better chances of pregnancy than frozen. Things are a little bit reversed right now, where we are finding better success rates with our frozen transfers. But back then, fresh was better. And so I was like, okay, we're going to do, get this retrieval and get my embryos, and we're going to do a fresh transfer. During my stimulation, when I was near my retrieval, we did my water ultrasound, my sonohystogram, and lo and behold, there was a polyp. And I was devastated because I was like, okay, we're going to go through the cycle. We're going to get my embryos, but I'm going to have to freeze because I can't do a transfer with a polyp in my uterus. And so we went through the cycle, got some eggs, got some embryos, had to freeze. We tested, found that there were 2 that were chromosomally normal. So the other ones were not. And then I went through the cycle, did my surgery, did my hysteroscopy, did my polypectomy. And again, at the time, I was just devastated that this happened, that I had to freeze my embryos. Went through another cycle. And in that cycle, also went very, very quick. I responded really, really quickly. Got embryos. They were all abnormal. And this was the point in time where I was like, they were all abnormal, sorry, except for one. This was the time that I wished that I'd frozen my eggs years before, when I was originally thinking about it. Because by this time, egg freezing was not considered, experimental anymore. I was like, oh, if only I did it back then, In any case, went through my cycle, did a fresh embryo transfer of my 1 chromosomally normal embryo that cycle, and got pregnant, had a beautiful, normal, healthy pregnancy, and delivered my first child in 2016. So she's, my daughter, Liva, is 3.5 years old now, and that was from that cycle. So that worked out well.
Let's underscore that, because there's a lot of people who only have 1 normal. And they need to hear that hope that you had one normal too, and you did a fresh transfer, and you have a healthy 3.5-year-old daughter.
We can pause there and appreciate that. Exactly. I was so thankful about that. And again, like at the time, I was like, oh, by the skin of my teeth, I'm getting through. If I froze those eggs when I was 34, I'd have so many more. But yes, sometimes it only takes one, right? And we know that if you have a chromosomally normal embryo, your chances of pregnancy are very, very, very high. It's just that it can sometimes, when you're at the age I was in my late 30s, early 40s, it can take a lot of eggs to get to that chromosomally normal embryo. In any case, so when my daughter was about a year or so, I moved out to LA, and we were trying again. And so this is kind of the hard part for me. We actually did conceive on our own. And this is something I don't usually share, but, since we are talking about my story, I guess this is here to share my story. I did actually conceive on my own, and unfortunately, and I was so happy. And we did CVS, and it was abnormal, so it was trisomy 18, which it was very hard at the time. It was finally, my body's behaving normally, and I'm able to get pregnant, right? And then did a CVS, and it was abnormal, and that was so horrible, so horrible. One of the hardest things is like living with this abnormal pregnancy inside of you, and like having just had seen the ultrasound, the baby was moving, and like you have all these hopes, and then like a few days later you have to have a termination because it's not compatible with life really. So it's like my mind had to be done, but that was terrible. That was a terrible time. I will say that the support that I received from my colleagues here at HRC was just phenomenal. They like really took care of me and made me and also obviously my family, like I had a lot to be thankful for, but it was like, I don't know how else to explain it. It was a yucky time, especially like just really the hardest part was feeling pregnant and like having to schedule the termination, right? Like knowing that like I had to do this in a few days. Like I hated it. It was horrible. Wow. In any case, I got over that, had the termination, waited a little bit of time, and then I was like, okay, I just need to get pregnant. I'm not trying on my own. We're just like going straight to IVF. I'm older now, in my early 40s. We need to test, make sure that the embryo is chromosomally normal. I'm not getting pregnant with an abnormal pregnancy again. And so we did some IVF cycles. Allison Peck was my doctor. She took amazing care of me. We did a number of here. She's my colleague here. She sees patients in Encino in HRC. We did, I'm trying to think how many IVF cycles. I think we did about 3 IVF cycles. One may have been canceled. One, I can't even remember all the details. We did at least 3. And in all of those cycles, there was one chromosomally normal embryo that resulted in total, which was a male embryo. And I was like, oh, this is nice. We can, hopefully have a boy. We transferred I will say Dr. Bustenfar and Dr. Peck were both my doctors, and Dr. Bustenfar did my transfer. We transferred the chromosomally normal embryo. My hopes were really high, and it turns out I had a biochemical pregnancy. Unclear why that was, but that happened. I do believe, even though we know that with chromosomally normal embryos, the chance of pregnancy is very, very high, but there are other things you have to take into account.
There are other things. We don't test for every single genetic condition in an embryo. We are limited with what we can test.
There are things we don't even know to test about, right? We know that like in a cell, there's mitochondria, there's cytoplasm, there's ectoplasm, reticulum, there's so many things. And probably with age, all of those things are affected. And so even though I knew the chromosomes were normal, at the age that I was, probably the egg, there was something that had the embryo didn't make it a viable embryo. And so I decided to go back, get my embryos from New York that were frozen a few years earlier, bring them to Los Angeles. And Dr. Peck managed my cycle. Dr. Bustenfar did my transfer. And with that transfer, I got pregnant. and now have my daughter who just turned 10 months 2 days ago. So that was very successful. And the one thing I just want to highlight here is that, when I went through my cycle the first time, I was devastated that I had this polyp and I had to freeze these embryos and I couldn't transfer them. And so that I had to subsequently do another cycle. If I didn't have that polyp, I would have just gone through the cycle, transferred them. I'm sure I would have had a baby that I would have loved, but like it wouldn't have been the baby that I have now. And I also would probably not have had the opportunity to do a second transfer because I would have just done that one first cycle. So I look back and I think, I was so devastated about that polyp and about that surgery. But honestly, that polyp and that surgery is the reason that I have my 2 daughters right now.
Unbelievable.
So, you never know, like, although, there are definitely things like we're faced with challenges in life, just in general, in all of our lives, we're faced with all these challenges, and not to like say, everything, I don't believe that everything happens for a reason. I really don't believe that, because I really do think
that hates that statement. Anybody who's gone through a crisis in life really hates that statement.
Bad things really happen. And when they're bad, they are really bad. Like that really, they are bad. But the one thing is that you really don't know the future. And you don't know that, something you think is really good, you don't really know, right? And something that's really bad, that you don't know the outcome of what that will be down the road. And that was the lesson that I learned from that.
I mean, I've like a heaviness on my heart just thinking about you also having to cope with your own emotions during all this difficult time while also helping other people cope with their emotions. As a doctor, how did you reconcile that? How did you cry every day? I mean, I'm about to cry right now, putting myself in your shoes during that time. Like, how did you get through that part?
It's a lot of practice. Like, as I mentioned, right, it was during my residency, during my training as a fellow, during even the beginning of practicing, I already wanted to have a child. And what was I doing day in and day out? I was taking care of other people who wanted to have children. So there was a lot of practice. There was a lot of years of practice of having to separate, right? Like, yes, I have all this stuff, but that's there. And now I'm taking care of this person to the best of my ability. I mean, listen, like I had patients who were like, had 2 or 3 children and they were in tears in my office because they wanted to have a 4th child, and here I was trying to have my first. But it's not about comparing.
No, right? Not at all. But you have, that's a difficult thing that even on the message boards on Facebook groups, people face all the time, right? And I totally get that. And
so I had to put that in a box for years, and I think that training, that practice prepared me for, I think, what was the hardest point in my whole journey, which was that point in time where I was carrying an abnormal pregnancy and I had to have a termination. And that was part of my fertility journey. And I still had to come to work every day, still taking care of people and providing that empathy when I was dealing with, I think, what was the hardest thing in my life. But I think the years of experience and the years of practice of putting all the other stuff in a box and still taking care of people prepared me to be able to do that at that point in time.
Wow. I mean, talk about accurate empathy. I mean, there's some doctors who go through IVF to have their babies, but you've touched so many areas that your patients have touched. 5 cycles.
Yeah, at least. I can't even remember how many, but yes,
I mean, 5 cycles. You've had a trisomy loss experience. You've had failed cycles. You've had all the things. Can you look at life before you went through all that as a doctor and life after and see how it's impacted how you even practice?
Yeah, it definitely has given me more empathy, for sure. For sure. I mean, listen, I don't think your doctor has to have gone through this, right? And I will tell you, a lot of doctors who practice IVF, even though they're not telling you, a lot of them have gone through their own fertility journeys. I think it's something to do with the training and pushing off having children. But makes us,
I know, you're already in your mid-30s by the time you get to be in practice.
Exactly. So a lot of us have been in that boat. But I do think that having had this experience gives me way more empathy than I would have had before. Even just the mere experience of like, this common thing of wanting to do things naturally. I feel like as a doctor, you're like, oh, whatever, if we did things naturally, like we wouldn't have medicine, right? And a lot of doctors kind of poo-poo that, or in medicine, we can have the urge, like just the inclination to be, what do you mean natural? But like having had that feeling myself, like I wanted to do this naturally. And I was faced with the vials, the syringes, the needles, like I said.
And that doesn't And I mean, that is such a big deal because we try to use the words assisted and unassisted but that's what we all feel. When we have the vials around us, it feels unnatural.
It feels unnatural. And so I can empathize with, that in a way that I don't think I would have if I didn't go through it.
Right.
So that's number one. And also even just something as small as people being freaked out by the needles.
Yeah.
I was that person. And so, so I talk people through it.
Yeah.
In a way that I don't know that I necessarily would have if I hadn't gone through it.
Right. That's incredible. I'm so grateful that you were willing to share your whole story.
I'm so grateful for you to bring me on and to interview me and help me share the story.
I'm so grateful about the kids, and, we have a lot of links to scheduling for Diana. So, her scheduler is going to be on that comment. The biggest takeaway from this is that, we know that there are people longing to have their baby and to have their, this journey start for them. It can still begin, just not in the way that we thought, given the COVID experience. But what I mean is you can still do a telehealth consult with her. You can still, get, have that first appointment. There are still even certain diagnostics that you can go through while we're all quarantined under stay-at-home orders. You don't have to completely wait. And because, people don't have the commuting time, there might be some extra time on their hands. Now is a perfect time to take those first steps so that you can have a plan in place for when you are ready to start the journey.
Absolutely.
That's the biggest thing. And I'm so, so thankful for HRC. I'm so thankful for how flexible all your partners are being and connecting with people via telehealth platforms, many of which are also available to answer questions in the Fertility Answers app. So you can find us on all the links to Dr. Chavkin's Facebook and her Instagram, and the scheduler are going to be in the comments and on Instagram and on YouTube. So we will see you for another hopeful story, but tune in. We have a lot of Facebook Lives happening, and definitely connect with this incredible woman and this credible doctor.
Thank you. Thank you so much, Alice.
Stay safe and enjoy those little babies. All right. Bye-bye.
Bye-bye. Thank you, everybody.